research started out many years ago because as a children's nurse, I was really keen to know how children are involved in treatment decisions and how they experience communication within the healthcare setting. And so I did research with children and young people, and that has informed a lot of what I do and has had a major impact at a global level. And it has influenced a policy on how children are supported to participate in healthcare encounters. And recently I spoke at the Council of Europe, where they've launched this across 46 countries, their guidance for healthcare professionals on how to support children in treatment decisions and communication, and how to do communication better with children. And it was heartening to see that my research that was conducted directly with children has influenced that policy and other policies across Europe. Recently I was involved in development with a very large group of clinicians and academics developing transition guidance for youth with diabetes across Europe. And that would have built upon my research with youth around transition. I really believe in the importance of empowering children and adolescents and helping them develop the skills to communicate with their doctors and nurses in the healthcare setting. And we developed 2 digital platforms. One is called steppingup.ie, which is based here in Ireland, which is freely available resources for youth to help them prepare for the transition to adult services. And most of these young people have chronic conditions such as asthma, diabetes, cystic fibrosis. And at the same time, as around the time that we concluded that piece of research, I was involved with working with a group of academics, Professor Betsy Sleet from University of North Carolina, and we developed another digital platform there called IUVEO. And that's a platform that provides advice to young people on a variety of conditions and also things that they might regularly encounter, such as substance abuse, depression, panic disorders, bullying, as well as asthma and diabetes and other conditions. So it's really important, I think, to co-design materials with young people that speak to them, that use their voices and uses their peers to speak this message to them, to help empower them, because they're the future and they are going to be the ones that are taking responsibility for their health. I led the consultation with young children here in Ireland aged 3 to 5 to inform the First 5 policy, which is a national strategy for children. So if you believe that children are able to say what it's like for them and they're able to voice their experiences, then you don't use age as an exclusion. You don't say, oh, they're not able to tell us what they think. And actually, when I was at the Council of Europe, they were very complimentary about all the work that we've done here in Ireland, because we have a national policy on children's participation in decision making, and I was involved in that as well. So when you have these policies and these standards, then they kind of promote better practice in the area. But I've also presented done many keynotes at international conferences, and because I'm very passionate about the area and I've spoken about it a lot, I've raised awareness of the importance of children's participation in their healthcare and in any treatment encounters, and that their views matter.